This is the Psychology in Film project by Kaleigh Magnant, Andrew Pickard, and Zach Hamil. We have completed a psychological assessment of the character Leonard Shelby from the movie Memento. Leonard, who is an insurance claim investigator, has anterograde amnesia, which he got after an accident in which he witnesses what he believes to be the rape and murder of his wife. He is now on a mission to find and kill the murderer, and because of his amnesia, he is not very trustful of other people, and he keeps Polaroids with descriptions and notes in his own handwriting, and also tattoos to help him remember what he believes to be facts. We have diagnosed Leonard with post-traumatic stress disorder. But first, what is the disorder?
PTSD, which is in the DSM-5 category trauma and stressor-related disorders, develops after a traumatic event has occurred after age 1. It is very similar to acute stress disorder, except that it lasts longer than 1 month. Many signs that point this out would be changes in arousal, cognition, and mood, along with constant re-experiences of the event that caused the trauma in the first place. There are many points in the movie that support our diagnosis of PTSD. First, to be diagnosed with PTSD, one has to have been exposed to actual or threatened death, serious injury, or sexual violence. In Leonard's case, he witnesses the rape and believed murder of his wife. He displays 4 of the intrusion symptoms, including recurrent, involuntary, and intrusive distressing memories of the traumatic event. Leonard is frequently plagued by flashbacks and dreams of the night his wife was attacked. Leonard also displays persistent avoidance of stimuli associated with the event. Specifically, Leonard avoids external reminders of the traumatic event by burning his wife's belongings that remind him of the attack. Leonard also displays alterations in mood, arousal, and reactivity associated with the trauma.
Leonard possesses most of the symptoms of PTSD, but some of them are due to his anterograde amnesia, not PTSD. For example, Leonard displays an inability to remember an important aspect of the event. He cannot remember that his wife survived the rape and attempted murder. This, however, is due to his head injury and anterograde amnesia, not dissociative amnesia.
Because of Leonard's anterograde amnesia, treatment for PTSD is more difficult. We would suggest a combination of both psychotherapeutic and biomedical treatments. For the psychotherapy, Leonard would go through a trauma therapy consisting of 3 phases. First, Leonard would be trained to regulate his emotions and become more mindful of the disorder. Second, Leonard would, with the help of the psychologist, would attempt to revisit the memory of the attack in order to learn how to tolerate it. Finally, the therapy would consist of reinforcing the skills needed to tolerate the memory of the event. Leonard would need to document the treatment and his progress in order to combat the effects of his anterograde amnesia on his therapy. This would be paired with a prescription for an SSRI, such as sertraline or paroxetine, and a plan to condition the behavior and to ensure the medicine is taken, because Leonard is able to condition himself into doing certain tasks without needing the memory. The long-term goal of the treatment is to allow Leonard to regulate his emotions and tolerate the memory of the event. This is an appropriate treatment for PTSD because it forces Leonard to come to terms with his emotions surrounding the attack and will hopefully discourage his vengeance towards the attacker. The anterograde amnesia could present issues with this treatment plan because it is dependent on his ability to remember his progress and to take his medication. If this treatment were to not work, we would suggest that he tattoo his reminders on his skin, like he does with other important facts he needs to remember.
The film does a good job accurately portraying PTSD, despite the focus of the film being anterograde amnesia. As explained earlier, there are examples of each type of symptom of PTSD present in the film. Movies are a primary example of exposure to psychological disorders in daily life. They aid in the formation of stereotypes surrounding these disorders. If portrayed accurately, movies can provide insight to society about what living with and/or knowing someone with these disorders can be like. If inaccurately portrayed, people can make inaccurate assumptions about the disorders and those affected by them. Then these assumptions become a widespread belief among society.